Hi, I'm here to perform inspection and auscultation of my patient's anterior chest and posterior chest. I already performed my hand hygiene. I already checked all those. I'm just supposed to do the inspection and the auscultation of the posterior chest and anterior chest. Yes. So I'll be inspecting my. I'll be inspecting my patient's anterior chest. Okay, so I just inspected my patient's anterior chest, and while inspecting, I noted for the shape and configuration of the chest wall. I also noted for the development of abdominal muscles, and it is as expected for the patient's age. And while inspecting, I noted my patient's facial expression. It is relaxed, and he was showing unconscious effort of breathing. And I also checked my patient's skin. It is free of lesion, and I'll need to check my patient's nail bed as well, and I'll be checking the capillary refill. Okay, I just checked that, and my patient's capillary refill was less than 2 seconds, and the nails are okay. It has normal configuration, and while I was inspecting as well, there was no bulging of the interspace during inspiration. So I'll be checking my patient's respiratory rates for 1 minute. So I just checked my patient's respiratory rate. My patient's respiratory rate is 18, and that is within normal limit for my patient's age. So I'm going over to inspect my patient's posterior chest. Can you please turn this way? So, okay, so I just did an inspection of my patient's posterior chest. The shape and configuration of chest wall is noted, and it's okay. And I also checked while inspecting. I inspected for his spinous process. It appears in a straight line. The scapula are symmetrical, placed in each hemithorax, and the neck muscles and the trapezius muscles have developed normally for my patient's age. And I checked my patient's skin color and condition. The skin color is consistent with patient's genetic background. While checking the skin, I noticed some like old wounds at my patient's back. I can see some old wounds on your back. What happened to you there?
Yeah, when I was younger, I was very playful, and I got these scars from previous plays, rough plays that I involved myself in.
Okay, thank you. So I just asked my patient about the old wound scars I saw at his back, and he said that happened while he was young. So yes, other than that, everything is okay, and there were no sinuses present, and there's no pallor present there. So I'll be moving over to auscultation of my patient's anterior chest. Can you please turn this way? So while I'll be auscultating, anytime I place the diaphragm of my stethoscope on you, you're going to take a deep breath for me. Thank you. So I'll auscultate the lungs field. I'll be starting from the apices in the supraclavicular areas down to the sixth rib. So I would start from there, and I'm going to go to the second intercostal and the second interspace, which is where the angle of Louis is. Then I'll be comparing the breath sound from one side to the other. I will be comparing. I'm supposed to hear vesicular sounds on the lung field area. So from there, I'll move down to the sixth rib. I'll listen to one full respiration in each location. I would also evaluate for normal sounds, which is supposed to be vesicular, and I will note for any abnormal breath sounds and any adventitious sounds as well. Okay, so for this, I'm gonna be starting. Can you please take a deep breath for me? So I'm moving to the second intercostal space, which is at the angle of Louis. So I'm going this way. Deep breath, please. Okay. So I just auscultated my patient's anterior chest, and what I heard was normal vesicular sounds. There was no any adventitious sounds in my patient's breath sound. So I'll be moving over to the auscultation of the posterior chest wall. Okay, can you please turn? Thank you. So for the auscultation of the posterior chest, I'll be evaluating for the presence and quality of normal breath sounds, and what I'm supposed to hear too as well is supposed to be vesicular sound. I'll auscultate from the apices at C7 down to T10 at the base. Then I want to hear vesicular sound. I do not want to hear adventitious sound. If I hear any adventitious sound, I'll note if it is on inspiration or on expiration. I'll also note for its loudness. I'll also note for the pitch and location on the chest wall. So I'll be going over to auscultation of my patient's posterior chest. Okay, so you're gonna, yeah, thank you. So that spinal process straight, I checked that already. So C7. So C7 is the prominence, yeah, on this. So I'm gonna do this. I'm not supposed to do that on the scapula, so I will check out for that as well. This is the scapula. Please take a deep breath. to T3. Deep breath. 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 Breath. Deep breath. Deep breath. Deep breath. Okay. So I just auscultated for the posterior chest wall, and when I auscultated, what I heard over the lung field was vesicular sounds. There was no adventitious sound, and there was no crackles while I was auscultating. So my patient's auscultation of the posterior chest went well. So that is what I have to do for auscultation and inspection of anterior and posterior chest wall. So I'm going over just what I need to do for my mental assessment. For my mental assessment, while doing the cognition test, I already did in my former video. I already did my patient was, when I was doing the cognitive test, my patient was allowed to place, time, and person. So for the second one, I asked for attention span, and you asked me to like, what other tests can I do? So for attention span that I did in the former video, what I did was I told my patients, I gave instruction for which my patient followed through. Another thing I can do for attention span as well is if my patient has been doing something for long, like maybe he's been going to the store for like 5 years, he's been writing his grocery list and he knows how to go to the store, and I now ask my patient, can you go to the store, can you write your list? And my patient now says, oh, I don't know what list to write, I don't know how to. So that means there's a shift in attention span for my patient. Another thing I can do for that is I can check my patient's memory. For memory, I'll be checking for recent memory, immediate memory, and remote memory. So I'm just going to be asking my patient some questions to test for his memory. So can you please turn? Okay, I'll say a word now and you will repeat after me. I am happy the term is ending.
I am happy the term is ending.
Okay, so I said a word and my patient repeated it. That was immediate memory. My patient's immediate memory is intact. I'm going to be asking you a question again. What did you have for breakfast this morning?
This morning I had oatmeal and banana.
Okay, so I asked my patient what my patient ate in the morning. This is 8:30 p.m. and he was able to recall what he had in the morning. So my patient's recent memory is intact as well. I'll be asking you another question. Can you tell me where you were born?
I was born in Nigeria.
You were born in Nigeria. So where in Nigeria?
In Oyo Town in Nigeria.
Okay, so I just asked my patient where he was born. My patient is almost 40 years, and I asked my patient and he just told me that he was born in Nigeria. So that's for remote memory. So my patient's remote memory is intact. So those are the things I can check for. I can do for cognition test. Yes, thank you. And that's the end of my video. I will be performing hand hygiene after everything, and I'll still be providing privacy for my patient. Thank you.